So now let's talk about contraindications. These are times when you should never apply K-tape. The first one is open wounds. So if someone has a laceration, a puncture wound, an abrasion, even if they're not profusely bleeding, you do not apply K-tape to a wound. They need different care. They need wound care, not K-tape. The second one is compromised or questionable skin integrity. This is especially important in older individuals who have very thin skin and maybe even weakened skin and can't handle or aren't good candidates for the application of taping to that region. The other thing to consider is anyone's general health of skin. So do they have a rash in that area? Do they have something going on in their skin? Is that an area that was recently healed from something else? These are all things to think about before applying K-tape. The third one is infection. So when we say infection, I think many of us think of an infection that we can see, so something obviously happening in the skin itself, which relates back to that previous topic of questionable integrity. But the other type of infection can be below the surface. So you can have someone who perhaps is post-surgical and is showing signs of an infection after surgery. Either way, whether it's on the surface or down below, you do not apply tape to this region because you can perpetuate the infection and you can actually contribute to the spread of the infection. Both very, very dangerous, so do not do it. The fourth one is a tape allergy. If somebody has told you, hey, I've tried K-tape before and my skin reacted kind of funny to it, don't apply it. It's not worth them having to risk a reaction for K-tape. The fifth one is a DVT or blood clot. So just think of this as any sort of blood clot in the region especially, but possibly if you're not a medical professional, I would just stay away from anyone with blood clots because with the increased circulation, you don't want to run the risk of that clot moving to a not safe region. So if somebody says that they have active blood clots, just stay away from it. The next one is an area that currently has a topical ointment, and this can range from anything like Neosporin to maybe some sort of topical lidocaine medication to help with pain, but you don't want to combine the two because the tape can seal in the ointment, and many of these topicals are meant to be applied to skin that is able to breathe. So if somebody tells you that they've applied a topical ointment that day, say, okay, well, let's not tape you today. Don't apply the ointment tomorrow and we'll tape you then. The next one is blood clotting issues. So we've already talked about active blood clots, but if somebody tells you that they have some sort of dysfunctional clotting issue, I would also stay away from this, especially because we've said it a million times already, the primary intent of K-tape is to assist with circulation. So if we have clotting issues, this could actually interfere with the clotting itself, whether it can facilitate or inhibit it, but either way, it's just safer not to tape somebody with clotting issues.